And now at 7, flu season this year will be a bit different due to the pandemic.
You may find yourself waking up and feeling sick and wondering if those symptoms are from the flu, coronavirus, or both. And here with us now to discuss the similarities and differences is Dr. Mayreen Hernandez of United Healthcare. Hello, Dr. Hernandez.
Good evening, Lauren, and thank you for having me.
Good evening to you. Let's start off with the similarities, doctor. How are both these viruses similar?
So the presenting signs and symptoms, usually things like fever, chills, headaches, stuffy nose, sore throat, and fatigue, they are very much alike at the beginning of each of these viruses, and they're both respiratory viruses. The other similarity is that they seem to have higher complication rates among those that are older than 65 years old and those that have chronic medical conditions. So both viruses carry higher rate of those complications. The other similarities is that they spread pretty much the same. So things like talking in close proximity, and coughing, sneezing, and also by droplets, right? By contact. So a lot of this is very similar. There are some key differences, though. The COVID actually spreads a little bit longer. In other words, the rate of the infectivity in the flu virus, you can come in contact with someone who's sick, and within 48 hours to 72 hours, you'll have those symptoms. With COVID, you could come in contact with someone that has it, and you can actually not show signs and symptoms for another 10 to 14 days. So those are some key differences among both the flu and the COVID.
Dr. Hernandez, is it possible to have both the flu and COVID-19 at the same time?
So we suspect, again, that you could. So part of one of the things that we are asking is to follow that the same distancing, social distancing, wearing masks, and hygiene also could help prevent the spread of the flu. But most importantly, Lauren, I basically, as a clinician, as a daughter, as a parent, is to get that flu vaccine. If you questioned about having it years prior, this year is not the year to question it. This year is at least prevent one virus that you can control until we await the vaccine for the COVID.
Yeah, I got mine a couple weeks ago. It was very easy breezy, and I'm even scared of needles. Now, let me ask you, doctor, if you think you have the flu, but you're not sure, what do you recommend?
You definitely should get tested because the presenting symptoms are very much alike. So you'll have to get tested. Again, if you've had the actual flu vaccine prior, that's a little different. You definitely need to get tested to know the difference.
You mentioned if you've thought in years past, oh no, I'm not going to get the flu vaccine. What else do you want to tell people? A final word to our viewers here who might be on the fence about whether they or not they want to get the flu shot.
So as a clinician, I hear all the time, oh, I got my flu shot last year and I got sick. And I tell them, you're not getting the antibody. You're getting an antigen. When you do get the flu vaccine, basically ensue those social distancing for at least, again, in lieu of the COVID, but also protecting because your body is developing and needs time to develop these antibodies, at least 5 to 7 days. So you may feel tired, especially right after getting it. You are then more susceptible, but you will need to give your body some time to actually build the antibodies. And please, please get the vaccine this year.
Dr. Mayreen Hernandez, thank you very much for joining us tonight.
Thank you.